that's an issue. But even more interesting is that when you take those 11 psychodynamic studies and those 8 CBT studies and put them aside, you're left with 3 studies, only 3 studies, where psychodynamic therapy was compared to CBT in one sample. In other words, in the same study, we said, what performs better, psychodynamic or CBT? In those 3 studies, here's what they found. In one of them, by Lieberman and Ekman in 1981, insight-oriented therapy, which they were calling psychodynamic, was compared to behavior therapy. And this was in a sample of folks with multiple suicide attempts. It's not clear why this was considered personality disorders because no diagnostic information was given, but nonetheless, that's where it is. What they found was the behavior therapy folks had less suicidal ideation and fewer suicide attempts at the 2-year follow-up period than the folks in the psychodynamic therapy. So in a study actually comparing them to one another in the same sample, CBT won. In the second of those 3 studies, conducted by Hardy and colleagues in 1995, they compared folks who had depression with a cluster C personality disorder or without in psychodynamic therapy and CBT. What they found was the folks who had both depression and a cluster C personality disorder who got psychodynamic therapy were significantly more depressed than folks who didn't have a comorbid diagnosis. So if you just had depression, you did pretty well, but if you also had this personality disorder, not so much. In CBT, on the other hand, people were recovered from their depression regardless of whether or not they had a personality disorder. So here again, when you compare CBT to psychodynamic therapy in the same sample against one another, CBT outperforms psychodynamic therapy. In the third of those 3 studies, this one conducted in 1985 by Woody and colleagues, they looked at the treatment of individuals with various combinations of depression, opiate dependence, and antisocial personality disorder. In that study, they actually didn't report results for each individual treatment. They said in an earlier published study, at a different time point, there were no differences, and so they didn't even look at them. Obviously, that's a bit of a problem here. But perhaps even worse than that is they looked at a whole bunch of group differences when the groups only had between 13 and 17 individuals. When you are making a statistical comparison with groups that small, you cannot find significant differences unless one group absolutely destroyed the other. So when you find equivalence in small groups, it doesn't mean they're equal. It means that one of them didn't clearly destroy the other one. You need a much larger sample size to do that. And the best way I can explain statistical power to you is to think of it this way. If you flip a coin 4 times and you get heads 3 times and tails once, you're not going to think much of it. But if you flip that coin 4,000 times and you get heads 3,000 times and tails 1,000 times, you're going to start to think, maybe this coin isn't actually weighted equally. There's something up with that. And so even though the proportion didn't change there, the number of times it happened, the larger your sample size, the greater your confidence that what you found is a legitimate difference. So in the study by Woody et al., the sample size was tiny. So you look at that, and any difference between the groups would have to be absolutely massive for you to have any confidence, or for it to reach what's known as statistical significance. So at best, according to Shedler, what this third study found was that they were equal. But really, we don't even know. So at least 2 of the 3 say CBT was better, and one of them says we don't know, or maybe they're equal. The only other studies he looked at in that meta-analysis didn't even directly compare them to one another. And yet somehow we walk away from this with the conclusion that psychodynamic therapy vastly outperformed CBT. So here's where I'm getting at with the meta-analysis in general, and with Shedler's study in particular, is people look at data that isn't very good data, they don't really look at it in a very good way, and then they make really profound statements about the results, and nobody actually looks at the studies that he's talking about to see whether or not that's true. In this case, they really simply aren't true. It isn't. A couple other things come up with the Shedler article before I sort of walk away from this video, because it's going to get a little bit long, I think. He spent a lot of time talking about the fact that, well, okay, maybe the difference between CBT and psychodynamic therapy in terms of how they work isn't such a difference after all. Maybe when other treatments work, it's because they do psychodynamically oriented techniques rather than doing what they really are supposed to do. And so what they did was they got therapy transcripts of some folks who got CBT and some folks who got psychodynamic therapy, and they had folks read those transcripts and rate to what degree they demonstrated strong therapeutic alliance, to what degree they implemented the cognitive model, specifically doing things like addressing distorted thoughts, challenging your thoughts based on evidence, and then this third variable called experiencing, which was quote, a description of, at the lower stages, the client talks about events, ideas, or others, refers to the self but without expressing emotions, or expressed emotions but only as they relate to external circumstances. At higher stages, the client focuses directly on emotions and thoughts about self, engages in an exploration of his or her inner experience, and gains awareness of previously implicit feelings and meanings. The highest state refers to an ongoing process of in-depth self-understanding, and that's supposed to represent psychodynamic therapy. So the problem with that is that happens in any therapy. That isn't just a psychodynamic process. That's the equivalent of me saying, well, CBT is focused on people getting better. So if they got better, that means they did CBT. That's not the case. There are a lot of very specific techniques involved in psychodynamic therapy, and in fact, Shedler explains them to you at the beginning of the article. This little variable has nothing to do with that. But even putting all of that aside, putting aside the fact that those variables are not a reasonable way of measuring this, the bottom line is people cannot, the people who are rating these things are clearly not blind to what treatment people received. It's obvious when you look at a transcript whether someone's getting psychodynamic therapy or CBT. They're very different. They use very different jargon. So the people who are rating this are not blind, and whatever bias they have is going to influence the outcome. And Shedler himself even says in the article that the bad results for CBT on this are qualitative, first of all, not actual quantitative differences, but they can best be explained by the fact that certain therapists administered CBT in a dogmatic and inflexible manner that doesn't work well with the therapist. So what they found is that if you do CBT poorly, hopefully you're at least doing something else good. Maybe some psychodynamic stuff, maybe some interpersonal stuff, maybe you just have a strong alliance. But if you stink at CBT, hopefully you do something else good. That's not the same thing as saying when CBT works, it's because psychodynamic therapy was really what was going on. And so you get all sorts of press coming out about this article, and you have Shedler himself making some pretty darn strong comments about psychodynamic therapy and the data behind it. But if you actually look at that evidence, it doesn't support those notions. And so my take-home point here isn't that psychodynamic therapy is bad. I'm not a big fan, but that's not the point. The point here is that people say things in the discussion sections of their studies, and people make decisions about what studies to include in their meta-analyses. And if all we hear are the conclusions of the authors or what journalists say about those conclusions, you're going to be misled a lot of the time. And in this case, what's being said and what's actually happening don't line up very much at all. And so I plead with you, please read our articles on PBB about this. Read about the actual studies and what happens. Or better yet, go to the Shedler article. Read his references section. Look at the studies he included. Look those up on a PsycInfo search. Or a PubMed search, and read those articles and see just how much liberty was taken with those analyses, because what you'll find, again, is that the results of all these scientific investigations support a much different conclusion than what's being said in the Shedler article. But even still, it's being repeated like a talking point over and over and over again by people who want this stuff to be true, and the more you say it, and as broad a scale as you can say it to, as wide an audience as possible, the more people come to believe it and see it as a fact, when in reality it's quite a bit of a distortion. So anyways, I hope to hear your comments. I hope you read our articles in Psychotherapy Brown Bag. I hope you ask whatever questions you have, and more than anything, I hope that you look at the evidence and make informed decisions, because this stuff really matters, and there are answers out there, and there is really, really strong science behind them. So I hope that you take the opportunity to read that stuff and make up your own mind based off of really good, strong information. Thanks.